So for everybody who doesn't know, I'm sure you know perfectly who Thivi is. Thivi's a consultant dermatologist, and she's got an additional expertise and experience in nutrition and the effect that nutrition can have on the skin and on skin diseases, but more importantly, skin health. And I think that as we move into this new way of delivering dermatology and delivering medicine, it's not necessarily just about the facts that we learn at medical school. There is a new way in which medicine is being done, and you're kind of really one of the forefronts in our dermatology community for actually having gone off and got all this additional experience in nutrition. So I am so grateful for us being able to do this.
Thank you so much, Emma. It's so nice to speak. It's always lovely to chat.
Even if it's not on the cricket field, which is the last conversation we had. So I think that what I'd quite like to do is to go through, the common skin conditions that we encounter and see, but also we always get patients asking us, what can I do to, can I eat? What should I be avoiding in my diet? And what should I be trying to do on a day-to-day basis to try and keep my skin good, as well as the topical skincare and as well as the medicines that we might be having. So I suppose to start off, Thivi, tell us a little bit about is there a certain diet that we should all be following? Is it a one size fits all? What's the answer?
So I think it's really interesting how you introduced Emma. Nutrition is part of how you look after your skin. It does give us the foundation, the building blocks we need for skin health. We need proteins, carbohydrates, we need fat, we need all of those things for the foundation of our skin, but it's only part of the story. And it's also important to have a great skincare routine and medical treatments if you need it, and other lifestyle factors, stress, smoking, all of those things. So it's part of a much bigger puzzle, I would say. It's a piece of the puzzle, but I wouldn't say it's the sort of cure to everybody's skin concerns. And I think that's where sometimes people can really go down a path where to just become fixated on their diet. And actually, it's just much more about having a balanced diet.
And what do you mean by a balanced diet? Yeah. What does that mean?
So really, I'm not one for restricting diets and omitting whole food groups. I think, you really need to make sure you're getting all your nutrients in your plate. And the way I recommend remembering that in the clinic is with this acronym GLOW. And I kind of introduced that really because people were always asking me, well, what should I eat? And I thought that was quite an easy, skin-friendly way to try and remember what the nutrients are. So we start with greens. That's your G, so that's all those colourful fruits and vegetables. It doesn't just mean spinach, kale, all of that stuff. And L, we need lean protein because the skin is fundamentally made of lots of different types of protein, whether that's collagen, keratin. We need to have enough protein in our diet to make sure our skin has those building blocks. And that lean protein can be vegetarian, it could be tofu, it could be eggs, fish, there's lots of different sources of protein out there. And O stands for oils. So good oils are omega-3, anti-inflammatory. Those are really great for skin health. That's kind of like your internal moisturizer that's really helping to support the skin barrier. And finally, we have W, which is whole grains. And I always find people are trying to reduce the amount of grains that they're eating, but actually whole grains are really important for gut health. And we have a much better understanding now that there is this gut-skin connection, and that plays a role in the health of our skin as well. So GLOW, easy way to remember the food that's meant to be on your plate, but I wouldn't get too obsessive. I wouldn't try and have GLOW every single meal of it every day. Just make sure you're covering it throughout the day.
Yeah, I love it because it was you introduced me to GLOW the last time we had this conversation, and I do use that now with my patients. Well, lots of patients, so that they may well think that I've come up with this concept, but actually it wasn't me that came up with this concept. It was Thivi. I just share the brilliance. But I think that's a really easy way to remember it. In fact, I kind of even my own self think about it that way whenever I'm putting a plate down in front of me and I'm thinking, is this, would this be Thivi approved in a way? Is this got all of the colourful things in it? And I think it's a lovely way, especially because most of us want to get that glow of our skin. So it works.
Yeah, inside and out. And, you might look at your plate and think, hold on, I don't have enough good oils. Maybe I'll just put some nuts, or maybe I'll have some olive oil in my dressing. They don't have to be major tweaks.
So that is one of the questions actually. So say whenever you say oils and you mentioned their omega-3, what kind of things would people be getting their omega-3 from? Like where do you get those oils? I eat lots of mackerel.
Yes,
I love mackerel. So
yeah.
that for me is an easy way for me. But you know, if people don't like fish or they don't like mackerel, they, you know, what would you be putting on your plate to get those oils that you say are good?
Yeah, so omega-3 is really found in oily fish. It's quite difficult to get it from other sources. Flaxseed would be your other main source of omega-3. So the oily fish that really good source, as you mentioned, mackerel, also salmon, that's an obvious one. Sardines are oily fish as well. Tuna is no longer considered an oily fish, so that got
Okay.
included. Lots of people think it is, but it isn't anymore. And you know, if you're following a plant-based diet or you're allergic to fish or you just don't like it, because it is a bit more tricky to meet your needs just through diet and nuts and things like that. So walnuts have also got omega-3. It is worthwhile taking, you know, when you need it, it's worthwhile taking supplements. And that's one situation where I would say an algae-based omega-3 is a really good idea. So if you're plant-based or allergic to fish, or don't like fish, then I would start taking a algae-based omega-3 supplement. You need about 400 international units. That's about right, 400 to 500 daily.
Okay. And you know, this is not a sponsored post or anything like that, but so are there any brands that you particularly would recommend that your patients would go to?
Yeah, so Vegetology do a very good quality omega-3.
You can see I'm making notes here.
It's not hugely expensive, but it's just a very good quality, and it's all vegan friendly for people who are on plant-based diets.
Okay, and one of the questions did come in. Sorry, I can't remember who actually said that question because the questions were coming in fast. You know, how much you said there 400 milligrams you recommended?
International units.
Sorry.
So 400 to 500 international units. It will just say IU on the packaging for anyone who's trying to work out which one to get.
Okay, and is that the same whether it's an omega-3 that comes from algae or if it comes from like normal fish? Is it
Yes, it's the same because the fish actually eat the algae, and that's where they're getting the omega-3 from. So
okay?
in a way, you're kind of bypassing that. But there are benefits to eating the whole fish. You know, it's got other protein,
Yes.
got anti-inflammatory, antioxidants like astaxanthin is very rich in salmon in particular. So there are benefits to the fish, and if you can't get it through your fish, then the alternative is this algae omega-3.
And is it better then to eat the oilier part of the fish than the leaner part of the fish, I guess?
Yeah, like a fatty. You mean the fatty
Yeah.
part of the fish? You will get more omega-3 if you're eating the fatty part of the fish. But generally, so for example, salmon, generally it's quite an oily fish. If you want to get more, say, fatty tuna and things like that, but the tin tuna doesn't have a lot of fat in it.
Okay. And do you mind to say the brand again? Somebody's just asking.
Vegetology, so VEGE.
Vegetology.
Yeah. Holland and Barrett also do a very good, reasonably priced vegan omega-3.
Okay. And then the whole grains you came to. So what do you mean exactly by whole grains?
So whole grains are sort of brown rice, whole grain bread. Sourdough bread is great because that's good for our gut. It's digested a bit more slowly. And, you know, we have quinoa, various different types of rice, you know, like wild rice or brown rice. There's lots of good sources of carbohydrate that are actually enriched in lots of nutrients. And when they're processed and they become the white version, they tend not to be as nutritionally beneficial. You get brown rice pasta.
Yeah, and one of the questions there said, so do you recommend that people would take an omega-3 supplement if they're unsure of how much they're getting in their diet?
If you're not having enough oily fish, which is 1 to 2 servings per week, then it's worth taking a supplement.
Okay, so that's useful to know. 1 to 2 servings per week.
Yeah.
Okay, that's really helpful, I think, for everyone. So
one fillet of salmon, so it's 120 grams. It's not a big serving.
okay, so if you're having fish several times a week for your dinner and it's one of these kind, then you're probably getting
Yes,
enough.
exactly.
And then if we think about some of the very specific skin conditions, we can maybe go into those one by one. So I'll think of all of the skin conditions that we obviously help at Klira. So many of these are facial skin conditions. And if we started off with acne to begin with, and is it okay with you if we divide it into the two kind of forms of acne that we think of here, where we've got that acne that's occurring typically in teenagers, and then we'll ask about the questions to do with acne that's probably occurring in adult female acne.
Yeah.
Can we split that up? Is that
Yeah.
okay?
Yeah.
Okay, so let's think about acne in teenagers. Always we get the question, is it the greasy foods? Is it the chocolates? Is it the sugar? Tell us, is it?
Well, you know, for in those teenagers, your hormones are wild, right? Your hormones are everywhere. Everything changes. So there's often this spell of teenage acne, which is, if affects boys and girls, and it can be, really quite disfiguring. It's also a time in your life you don't want to be restricting your diet. It's a very sensitive time, body image, and so criticizing someone's dietary intake during those very sensitive years is really not a good idea. You do want a healthy, balanced diet. That doesn't mean cutting out all sugar. That means keeping your sugar intake within the healthy range, which is 30 grams a day of added sugar. And if you're having lots of sweet fizzy drinks, that's not a great idea generally for your health. You're going to exceed that very quickly. So things that can potentially make acne worse, if you're having excess refined sugar, in some people that can cause breakouts to worsen, but it's not everybody. Some people can eat 10 packs of Haribo, they're never going to get a single spot. So it just depends how sensitive you are and how your body reacts. So the other sort of food group that's often attributed to breakouts is milk. And it isn't all milk. The data seems to be a little bit better for skim milk, but this is not solid. Not everyone who drinks skim milk is going to get acne, certainly not. And it's very important to protect bone health during that critical time. So you don't want people of that age to be cutting out their, milk. So actually, during that period, I think it's really important, if you're thinking diet may be playing a role, you need to go to a specialist to talk about it, because obviously, your self-esteem can take a huge knock during that time. And I wouldn't want someone to be trying to fiddle with their diet when actually skincare is so important. Topical retinoids can be life-changing. And some people need oral treatment. So I think you've got to take that mental health piece really into consideration during those years.
Yeah, so I think that's right. So the evidence is really with what we would say in terms of the topical treatments that we would use, then escalating that up to the oral treatments if necessary. And then diet, really, it goes alongside those treatments. It's never going to be the thing that's going to fix it in its entirety.
Exactly. So it's not the cure, and that's a conversation I have a lot of times in the clinic. Yes, there'll be people with some mild acne, and when they, a few spots here and there, and if they have a bit less milk, maybe it gets better. But the people who are coming to see us using prescription skincare, actually, it's really important that you get the right treatment and you prevent scarring, then you spend a long time playing around with your diet.
Yeah. And if we move then on to adult females who have acne, that there's obviously a lot of environmental factors that impact that as well. A lot of hormonal factors impact that. And also, I feel that that group of women will often think about things like stress and sleep playing a big role in the development of their acne, but also lifestyle in terms of pollution and other kind of oxidative stressors. How big an impact then do you think diet has on this group of acne patients?
So it's really interesting. So from my experience, I think, there are some women who've got adult female acne that just happen to have acne, and their hormones and everything, if you measure them, actually they're fine. Their skin is just a bit more sensitive to their circulating hormones. Then there's this whole other group of women who have more in keeping with polycystic ovary syndrome, and they may have insulin sensitivity, insulin resistance, sorry. They may have other features like irregular periods. And it may be that actually diet plays more of a role in that group of people. So if you are more of a PCOS girl, it might be that diet plays more of a role for you, and really making sure you have plenty of whole grains, looking at blood sugar, making sure you've got lots of not having too much refined sugar in your diet. To me, and in my experience, that's a group of people I see that diet plays more of a role in. However, I do see the other group of patients really trying hard with their diet as well, really trying to fix their skin with their diet. And it can have some improvement, and I do think you need a good balanced diet, whatever you're doing with your skincare, to get the best results, but you have to do it all together.
Yeah, I think that's that's right. I think the women who as well who I see with polycystic ovarian syndrome, diet certainly plays a role, but actually for many of them, because of this insulin resistance that they have, and then the feedback that goes back into the androgens, then they almost become in a vicious circle of the weight becoming worse, the insulin resistance becoming worse, and then the androgens becoming worse, and then the acne getting worse, and the hair growth getting worse. And often it's the use of oral medications really required alongside the diet. And sometimes injectable treatments are required as well. And now, I actually messaged you just last week, didn't I, to say, what was the name of the supplement that you recommended for women with polycystic ovarian syndrome? Because you recommend this and somebody else had recommended it, and I had a patient in front of me in clinic. So thank you for responding. Because we talked about this again the last time. Can you talk a little bit about that supplement for anybody who's listening and what it would do and the role it can play?
So there is a supplement called inositol, and there's been a lot of research into inositol, usually really under gynecology, because it has been used for some time now to improve egg quality in people who are undergoing either IVF or egg retrieval or trying to conceive who've got polycystic ovarian syndrome. And it seems to act as an insulin sensitizer. So as we know, in polycystic ovarian syndrome, you have resistance to your circulating insulin. So you've got high insulin levels, which make it difficult to conceive at times. And the role of this vitamin is actually to improve that insulin sensitivity. And there are excellent studies in terms of reducing insulin resistance. It's fantastic for egg quality. It can help to make periods more regular. And there's been one study in acne as well. So if I have a PCOS patient, it's definitely something we're talking about in the clinic. And it's a supplement you can try it for 3 months and see how you get on with it. And you have to look for a very specific ratio, which is the one that's been studied, and it's D-chiromyoinositol, and the ratio is 40:1. So you just got to look for that 40:1 ratio.
And it's the Vitabrites brand that you recommend, isn't that right?
Yeah, there are lots of good brands. That one is the one I routinely recommend because it's just so clearly labeled that it's got the right ratio. But as long as it's got 40:1, that's the ratio you're looking for. Some of them that are marketed to PCOS actually only have one. So they only have the myoinositol, but you really need both to get the results that they're talking about in the studies.
Okay, I mean, that's, I think, really useful information. So for people who have the skin signs of PCOS, then typically we recommend the use of a topical retinoid. That's kind of key, and actually topical azelaic acid, the way we would make them up in the Klira formulations, but in combination with a vitamin like this. And then for some people, it's going on to different types of hormonal control or spironolactone, and then usually help with insulin resistance as well, whether that's with metformin or one of the GLP-1 agonists. I think it's such a good kind of collection of medicine that's available now, really, isn't it?
And it's so focused, rather than just putting everyone on the same treatment. Actually, we're saying, look, this is a particular aspect of women's skin health, and it needs targeted treatment that's really focusing on the cause. What's driving this acne? Because there are other treatments for acne available, but is it really addressing the mechanisms that we're talking about here?
Yeah, and I do find that quite frustrating, because the guidelines for acne are based on those guidelines that are typically set up for acne of puberty, as I think of it. And some of those harsher topical treatments, they're not really that great for a woman who might be in her late 30s, in her 40s, even her 50s, or having these kind of symptoms. So I think it almost really, we should be thinking about it in two separate ways and addressing it in this much more targeted way that we've just been speaking about now. So that's helpful. Okay, taking a switcheroo, let's move on now to rosacea.
Yes.
This is, and again, let's divide the rosacea up into the different types of rosacea, because again, it's not just one thing. Let's think about the rosacea for those patients who have the drier type of rosacea, where their skin will flush and flare. And yes, they might get the odd spot, but it's not really about the spottiness of the rosacea I'm talking about. This is about those flushing and flaring. Is there diets that you recommend that are helpful for patients with that type of rosacea?
Well, first of all, it's about avoiding the triggers, and you'll get to know your own trigger. So that might be alcohol, it might be coffee, but there will be certain things that are going to make you flush very readily. And it's about keeping those to a minimum. So if you love a hot coffee, just let it cool down a little bit. If you like spicy food, just moderate it a little bit rather than having, something super spicy. And if you like alcohol, then wine, beer, and champagne are going to be the main triggers because they have more histamine in and can make you flush. Try and go for clear liquors instead. So there are little tweaks that you can do to minimize that flushing. And with the dryness, so the data for omega-3 supplements for dry eyes in rosacea is quite good. So actually that's something we do talk about quite a bit in the clinic, about whether it's worth trying some omega-3 supplements to help with skin dryness.
And what kind of dosages are you giving, the 400 international units?
Yeah, so between 500 and 1,000. I think for the studies they did 1,000 actually.
Okay, and that's, I suppose, really quite helpful as well. Just that point going back, we did talk about acne, but we didn't talk about the treatments of acne. And one of the treatments of acne is isotretinoin, and omega-3 can be very helpful with the side effects, especially these mucocutaneous side effects of isotretinoin. Isn't that right?
Yeah, so it can help with the dryness, so dry lips, dry eyes. It may also help with, sometimes people's cholesterol go up. Young, fit, healthy people, sometimes their cholesterol goes up. So that might help to add some good fats into the blood as well.
Okay, and so for rosacea, and you mentioned histamine, what about things like, we'll have a lot of people who'll come in and they'll be taking probiotics or other forms of gut health supplementation because of this thought that rosacea and the gut are linked, and the rosacea and small intestinal bacterial overgrowth, or SIBO, these are linked. What is the evidence for that, and is there a diet or a special thing that should be followed?
So with SIBO, SIBO, it can be linked to papillopustula. It's a specific subtype of rosacea. So rather than the red, flat, dry, flushy type, a bit more spotty type of rosacea. And that can also be linked to another gut imbalance called H. pylori, which is a different bacteria that overgrows in the stomach rather than in the small intestine. Both of these you can do breath tests for. So usually under the supervision of a doctor, you'll be doing these tests. You can do a blood test or a breath. So SIBO testing is a breath test. H. pylori, you could do a blood test or a breath test. If you're found to be positive for H. pylori, the treatment is usually a few antibiotics in combination, and sometimes that can help rosacea, sometimes not. If you have SIBO, there's a few ways to approach it. It can either be dietary, and you need to be, you need to see a gut-specific dietitian to talk about it, dietary with specific probiotics, or there's an antibiotic that you can take. And there is some evidence that that antibiotic that treats rosacea, that treats SIBO actually might help rosacea, even though you're only using it for a short period of time. But that is, when you're going on a SIBO diet, that's something that you would do under supervision, because there's a lot of discussion around what's the right probiotic, because some probiotics actually produce histamine and can make rosacea worse, so you do need to be careful. So the two I tend to recommend in the clinic, and obviously this is not sponsored, BioCult and Optibac, those ones don't contain those higher histamine probiotics.
They're the ones that I recommend in clinic too, partly from the first conversation we had where you told me about those ones. So I'm the same. And do you give your, so if somebody has been given antibiotics for rosacea, which happens, it's a very standard treatment. So, if we can treat things topically with rosacea, our top choice is to use 1% ivermectin and 15% azelaic acid. And actually combining these together is even better. You get this synergistic effect. And at Klira, our formulation contains both the azelaic acid and the ivermectin with a teeny bit of tretinoin as well to try and help drive that in and kind of help both of them. But if you then move on, for some people, they might need to take a tablet by mouth. And sometimes that's an antibiotic, and sometimes it is a low dose of the isotretinoin. In those patients that you give an antibiotic to, do you then, and they're on this for a long time, so would you then recommend that they get a probiotic as well?
I quite like to recommend that. So if someone's going on antibiotics for acne or rosacea, I do like, and we use it for several weeks, sometimes months. I do like to use it alongside a probiotic, because there is some data that it can help the antibiotics to be more efficacious, but it also increases tolerability. And from my experience, I get a lot fewer issues with the two most common antibiotics that we use since I've recommended probiotics use alongside. The trick is don't take them together because they're kind of, the antibiotic will cancel out your probiotic. So if you're taking your antibiotic in the morning, take your probiotic at lunchtime, something like that, or in the evening. But yes, I find that it is helpful to just help with the digestive discomfort that you can sometimes get with being on antibiotics for quite a long time. It's definitely a go-to in the clinic. And I do love that Klira formulation of the triple. That's a really good one.
Yeah, I love it. We've had just some comments as well coming through saying, "Oh, that formulation is amazing. It's changed my life." I've had those come all through.
And the
And
tretinoin is a really nice added extra because often we don't put those all together. We don't have it together normally. So, and people don't like using lots of different creams. So it's so nice just to have it in one pump.
yeah, and I love as well because that formula is this, it's a serum, so it's much easier to put on, which often people will find when they have that. If they have the oily rosacea, they don't want to be putting a thick cream on. And if they have the dry rosacea, sometimes the cream causes that inflammation and irritation. So it's quite nice that this is in that lovely serum form that goes on and glides on really easily. And then if we then think about you mentioned in rosacea, these breath tests that people can do. I've seen these that people can test for it on the internet and they can get things sent to their house. What do you think about those? Is that a convenient way to do it or not?
You can do it at home, but you've got to go for a reputable brand that's actually measuring the levels properly. So I think the one that often gets recommended is Health Path. They're very good. Not just the doing the test at home, which you have to follow really carefully. There's a special diet that you need to follow before you do the breath test, but it's actually interpreting the results as well. And that's why it's always good to do it under the supervision. And really, there are lots of dietitians who really specialize in gut health. I would strongly recommend that you are under somebody just to really talk through those results.
And how would somebody find a dietitian that is a specialist in gut health? How would they know who to go to?
You can look at the British Dietetic Association website. The Nutrition Association for Nutrition has also got a list of specialist practitioners for each of their sort of fields of interest.
Okay, and that's really helpful because I do always think that and think, well, I wonder where people go. It's a bit like when they say, where are you going to go to get a dermatologist? And I was like, how do people get to find their dermatologist? And then an area that's not necessarily so much covered at Klira, but is an area where diet can play a role is in psoriasis.
Yes, yeah, and that's really our main research that we do at King's is on psoriasis, and we're looking at how these different diets can influence the health of our skin. So we're doing intermittent fasting, which is so popular, and we're looking at a Mediterranean diet. But really, what do we know so far? So what do we know about psoriasis, this inflammatory skin condition that is really common and it can be really debilitating? So there's a couple of things that can profoundly influence psoriasis severity. And one of them is a little bit of a tricky topic to discuss, but weight does play a role in psoriasis severity, we think, the data that we have. And so trying to keep your body weight within the right range for you is really important. And you may need support to do that. That may be through your doctor, it may be as a dietitian. But that seems to be a very important part of the whole holistic management of psoriasis. It also helps some of our treatments to work a little bit better as well. So there is the role of body weight, but there are also these sort of anti-inflammatory diets seem to be beneficial in psoriasis. Most of the research that we have is for a Mediterranean type of diet, so lots of legumes. These are just healthy diets in general. Lots of olive oil, oily fish, just as we mentioned earlier. So that really nice anti-inflammatory diet seems to play a role in psoriasis as well. And studies have shown that, yeah, it's helpful.
Do you think then that almost psoriasis can serve as a model because obviously it's an advanced form of inflammation within the skin anyway? Do you think it almost, whenever you discover these things that within your diet that have an effect on psoriasis, do you think that could probably be translated just in general about what is going to be beneficial to the skin? Because presumably if you're causing more inflammation to the skin, hence your psoriasis is going to get worse. I wonder, would that then convey perhaps even things like in terms of aging of the skin or additional oxidative stress or damage to the skin? Do you think that's something that could then be translated across?
I think so, because psoriasis, it's easy to see because you've got these inflamed patches and they can clear. And if you I'm not saying that if you follow a balanced diet, your psoriasis is going to completely be cured, but you may see quite a bit of improvement. And so we can see it with psoriasis because you've either got patches or you don't. But interestingly, that may be giving us clues to what's going on with healthy aging, because inflammaging, as we now call it, inflammation is such an important part of how our skin ages. So following these diets may be beneficial. I mean, I don't doubt for a minute that they're important for how our skin ages in the long term.
Yeah, I think that's right, because the inflammation and the inflammasome, as you talk about it, that is what contributes to the aging of our skin. So if we're then trying to think about a diet that's going to be as good and help our skin stay as young as possible for as long as possible, then I would imagine that whatever nuggets of information you learn, we're all going to be doing that to keep our skin looking great.
It definitely spreads more widely because, when you have all that oxidative stress, when you have high levels of sugar in the blood, it can cause your collagen to become stiff. That oxidative stress damages your collagen, and everything we do, whether it's topical retinoids, sunscreen, is all about preserving collagen levels in the skin.
Yeah. And so just the very last point then is that if somebody did say to you, well, what can I do now? What evidence do you have of what I can do to keep my skin looking as young as possible for as long as possible? And I'm thinking of that particularly for people who might be on the Klira specials, where they're repairing photo damage and they're trying to get their skin reverted back to this younger looking or them a few years ago, let's say. What kind of dietary information do we have now from that perspective?
So, really, the diet we've been talking about. So, really
Yeah.
colourful, looking after your gut health, really making sure you're eating the rainbow every day. And then there are things that we all love but shouldn't have too much of: alcohol, sugar, caffeine. Just caffeine I don't worry so much about, but the alcohol and sugar definitely can increase facial skin aging. Sugar can lead to what we call sugar sag, where your collagen becomes stiff. So, if you're investing in a fantastic skincare routine and you've got great products, you've got to match it with what you're eating as well, really get the benefits of everything. And we're really fortunate in dermatology, we see how the skin reflects dietary changes, and that's also telling us what's going on the inside. So anything you're doing to improve your diet for your skin has a knock-on effect for your overall health in the long term as well.
I mean, I think that's a perfect almost ending, really, isn't it? That describes it perfectly. But just one question, because it has been asked a few times. Collagen supplements, should people be taking them?
So, I actually think there is something there with the collagen supplements. I think they don't work for everybody. I think some people do see benefit from them. I've done a deep dive in the literature. I think it's really interesting. You need to try it and see if it works for you. You need to make the decision. Do I want bovine, so from cow, or do I want marine, which is coming from fish? And, a powdered one, they're pretty much all very similar. Some of them have a few added ingredients, but the same. If you are trying one out, you'll know in 6 to 8 weeks. For me, I noticed my nails were growing faster because I had to do my nails more often, and I couldn't believe it. I was like, I normally go every 3 weeks, now I have to go every 2 weeks. So that was my clue. I think my skin was slightly better hydrated, but I didn't see a huge difference in the skin. But it's really individual, and I think you've got to try it to know if it suits you and if you see an improvement.
Yeah, I think that's right. There's certainly evidence to show that it can make the skin a bit more hydrated, but the rest of it is a bit more complicated to try and prove that it's actually making that big difference. I mean, I did try it myself for 2 years and used my confocal microscope to try and find out. Yeah, but I'm going to say I don't take it anymore. It's like it's really expensive, and especially I have to go get my nails done more often. That's even more annoying.
Evidence-based ways of looking after our skin. We've got retinol, sunscreen. I would always go for that first before reaching for collagen.
Yeah, a really, really good skincare routine to protect against our ultraviolet radiation and oxidative stress, and then repairing with whatever the condition it is. There is a treatment solution for it. At Klira, obviously, that's where we're calling in from. But look, thank you so much, Thivi. I always enjoy talking to you, and I've already made notes that are going to benefit my patients in clinic, and I'm sure your information has benefited so many people as well just now who have joined. And thank you everyone else for joining. I'll put lots of the links that Thivi's talked about in the info below as well. So thank you so much. Thank you.
Lovely to see you, Emma. Bye.
See you in the cricket pitch. Bye.
Bye.